Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Denise KEKIMURI is a perinatal bereavement advocate, a role she took on in 2018 following a miscarriage she suffered in 2017. With many questions on her mind, KEKIMURI put all her thoughts in a book, but continued to dig further for explanations to her misfortune.
I went for tests. This was 2020 March, and I found out I had PCOS, so that's polycystic ovarian syndrome, which means you have too many eggs, but they have cysts on them. So I Googled, of course, you're now going to Google. Google is the worst thing. But my doctor kind of told me that this is something that happens, it's genetic.
What kept her doubting was the fact that she had effortlessly had a child some years back. So what could have been the issue this time round?
When I told him that I had a 11-year-old, he's like, yeah, so you're dealing with secondary infertility. What that means is you have to be very careful with your next pregnancy. You have to treat yourself like an egg, basically, because you're already impaired, right? Right from conception. Even conceiving will be hard.
But what is secondary infertility? Dr. Gonzaga Andabati, a fertility expert with Bethany Women's and Family Hospital, elaborates.
The commonest cause we see is tubal problems. Problems with the tubes, either complete blockage or partial blockage of the tube. And in terms of how common, about 60% of all cases of infertility, which are secondary infertility, are caused by tube problems. That is 6 out of 10 of all cases of secondary infertility are due to the tubes. And this is resulting commonly from infections. Either sexual transmitted infections or infections because of a pregnancy which was lost, but it wasn't managed well. An abortion which was, which occurred spontaneously, but they didn't get the proper treatment after the abortion. But the woman has a specific age within which she is able to bear children. And this is predetermined by biology, that is the eggs. From the age of 10 years to the age of 35 to 40 years. For the men, it's a bit not very well defined, the end period. But from around 65, from 60, 65, 70 years, the production of the sperms also goes down. And
another lady, JULIET SEGWANYI, an entrepreneur, has never found an appropriate answer for her ordeal.
Unfortunately, I've had what they call recurrent miscarriages. The first being around 2013. And with miscarriage, it happens before 20 weeks. So for me, it was, partly that. But then, even after doing tests, finding out that, okay, that wasn't the reason. So what was the reason? Maybe like if it's the second one, it's not the genetic problem. So now what is the reason?
According to Dr. Andabati, there is a trend they have noticed in clinical practice that may partly explain the phenomenon.
The couple have already had a child before, and now they think it's easy and obvious to get another one. And so they start delaying. And at first they don't believe that actually this is true, and they don't want to first seek the formal treatment.
Following the experiences of KEKIMURI and SEGWANYI, they have created a safe space for couples to share and get expert medical and counseling services in Mutungo, Kampala.
And that's how Mwesigye was born, out of support groups. And so we offer psychosocial support to women and couples who are going through pregnancy loss, baby loss, and infertility.
However, KEKIMURI says men are not forthcoming.
And you realize that most of the time it's lack of communication. So and that was the first time we hosted men. Then after that, men are like, oh, now we need a WhatsApp group. That group died. It died a natural death and died. So after that, we decided if you're coming to Verso with me, you come as a couple.
Longtime advocate for infertility and CEO of the Merck Foundation, Dr. Rasha Keleji says there should be diversity in addressing infertility.
Advocacy, talking about it will make it as easy as talking about flu. Do you remember HIV when it was taboo to speak about? Now it is normal and normalized through media, through people, through films, through episodes, through soaps, through songs. So I think this is going to be the way.
Nonetheless, there are known remedies to help people suffering infertility have children.
We can use medications to manage the effects of secondary infertility by increasing the number of eggs, by improving egg release. We can improve the tubes by procedures. There are some procedures like laparoscopy, surgery where we can correct the tube problems. Yes, but also if that is not possible, there are also options which are classified as assisted reproductive treatment, what we call ART. They are available in this country, including in this unit. We have been doing this for quite a long time, and it's available. Things like insemination, or we can do IVF, in vitro fertilization, especially for cases where the tubes are completely blocked.
Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.